I was really looking for a program that was going to put me to work. I wanted to be at a place where I was not just going to be an observer. And medicine is not a spectator sport. It's really about getting in, doing the work, and I can say that that's 100% true of how this program is.
This is a perfect program to come to if you want very rigorous, very broad clinical experience, but you wanted an environment where you have very supportive, engaged faculty and a lot of strong camaraderie and teamwork together with your fellow residents.
I really wanted a program that was focused on serving the community, integrating into the community, worked with more vulnerable, marginalized patient populations, and a program that had a strong obstetric component to it.
There are opportunities to explore almost every interest you have, whether it's transgender medicine, whether it's medical care of incarcerated populations. We're in New York City, so we have many, many opportunities.
You are involved in everything from day one, you're operating from day one, you're in didactics, clinic, the operating room, the labor and delivery room, triage. You're in everything from day one.
On my first day of GYN, I was in a couple of cases, and after my first case where my senior walked me through it, I was doing all the rest of the cases with the attending. And to me, it was like I was a med student yesterday and today I'm a surgeon. We see everything and we are hands-on from day one, which is great.
We are the ones delivering babies, doing repairs, doing surgery with our supervising attendings, and we work with them as colleagues.
The residents are there side by side with the faculty for every part of their day. So the faculty support the residents both in running the labor floor, they support the residents through their time in clinic, teaching them how to see patients. It's a really side-by-side experience, and the residents spend a lot of time one-on-one with the faculty.
The faculty are integral to a residency program. They really are our teachers.
Here at Mount Sinai West, we serve a very complex patient population. We're in the middle of New York City, and our patients are medically complicated, they're surgically complicated, and there's a lot of psychosocial stressors in this population. Our residents learn that it's really a privilege to take care of and to learn from these patients, and it provides a wonderful opportunity for growth.
Learning outpatient care, post-operative care, and how to do a lot of the gender-affirming surgeries that GYNs perform.
I liked that you had a very diverse, robust patient population, as well as the complex pathology and really top-notch surgical exposure. So it let me get my foot in every kind of pot, particularly as someone who wants to be a generalist.
We have every fellowship available to our trainees, and that means that we have complex patients in every subspecialty of OBGYN and excellent learning opportunities throughout. We're very committed to providing an excellent educational experience for all of our trainees, residents, fellows, and medical students. And what that looks like is residents have protected time for learning. We have a very mature global health program. We have one of the leading complex family planning programs in the country. And so our residents really learn not just clinical care, but how to do research, how to do quality assurance, and really become leaders in their field.
There's not too many programs that can balance getting amazing surgical and clinical experience while also not giving up anything on the wellness aspect of residency. You're able to learn, but at the same time, you're able to still be a human being and enjoy your life outside of residency.
Our residents maintain some of the highest well-being scores across the institution, so they're happy, and that's really important to me.
Well, residency is a really difficult time. You're learning things that you've never learned before that affect people's lives, and so it can be very stressful. And we always just make sure that we have ourselves as attendings, but especially the class mentors, available to listen. Everybody cares and everybody listens.
It's just really nice to have someone who wants to make you better, is invested in your education, and also cares about your life outside of residency.
These are some of the toughest 4 years of your life, and rightfully so, because medicine is not easy. But if something can make it a little bit easier, it's being in a place that you love with people that you love working with. And I can say that here at Mount Sinai West, I definitely have had that experience.
I love our people. I love my co-residents, I love my class, and I love my chiefs who I view as mentors, and I love the camaraderie between classes.
Not every program will let you blossom into the person that you're supposed to be, that will make you feel comfortable and safe asking questions, that will give you the space and the support to find yourself. And that, I think, is really, really important. And Mount Sinai West does that.
We have residents that are really passionate about patients, they're passionate about outcomes, they're passionate about their education, they have a real vested interest in our department and where healthcare is headed. And we know that in the long run, they're going to make a tremendous impact on patient care.
Think on my feet, think critically, and anticipate problems before they arise is definitely something that I've learned here.
It will satisfy any interest of any potential applicant. No matter what you want to do, you'll get that here, and you'll get it with the best community behind you.